Hello and welcome everyone to the cardiovascular disorders, and what could be more central or more important than the cardiovascular disorders. That's why we're devoting 2 units to discuss the most important cardiovascular disorders that you might encounter. And let me start first by discussing some vascular disorders. And I'm going to start with the peripheral arterial disease. What's peripheral arterial disease? What's claudication? You're walking and all of a sudden your calf muscles are hurting. You have like calf attack, like heart attack. You have a calf attack. You have severe pain in your calf muscles and you have to stop walking. Why? Because you have ischemia in your calf muscles because you have a peripheral arterial disease. So the major symptom here is claudication. What's claudication? It's pain in the extremities on exertion, and it is relieved by rest, most commonly presenting in the lower limbs. And by examination, you will see loss of pulses in the feet, depending on the level of obstruction. Maybe you cannot feel the dorsalis pedis pulsations. Maybe you cannot feel the anterior tibial pulsations. Maybe even you cannot feel the popliteal pulsations. And because of this ischemia to the lower limb, we get some ischemic skin manifestations. The skin is going to be smooth and shiny, and there will be loss of hair and sweat glands in the affected areas in the lower limbs. Then how to diagnose it? The best initial test is the ankle-brachial index. Let me explain something here. As I'm standing right now, where do you think I have the higher blood pressure? In my arms or down there at my ankles? Definitely it is at my ankles. Why? Because I have the same blood pressure, of course, but in my ankles the gravity is adding some pressure to it. So normally the ankle pressure, the pressure measured at the lower limb, is normally higher than the pressure measured in the upper limbs. How about having the pressure in the ankles lower than the pressure in the upper limb? This means that you have insufficient circulation going down there. And usually if it is less by less than 10%, it's not a big deal. But when the difference is more than 10%, the lower blood pressure, the ankle blood pressure is lower by more than 10% or more than 9% to be very specific, than the pressure in the upper limb, then we have an ankle brachial index that is low. So the normal ankle brachial index should be more than 0.9. Should be more than 0.9. When it is less than that, when the difference is more than 10%, this means there is an obstruction. But the most accurate test still is going to be angiography. Why do I need to do angiography? Not only to diagnose the condition, but also to be able to locate where is the problem, which segment is exactly causing this problem. And of course, the major pathophysiology of the peripheral arterial disease is the same pathophysiology as any ischemic condition, which is atherosclerosis. I have atherosclerotic plaques obliterating, obstructing, narrowing the lumen and decreasing the flow in the lower limb arteries. I can have the same manifestations happening acutely due to acute arterial embolus, arterial embolus. And here the key word is going to be very sudden ischemia, very sudden loss of pulse, very sudden severe pain and cold extremity. Usually we see this in association with atrial fibrillation or valve disease, which is the source of the emboli. And this emboli can travel down the arterial stream and becomes block one of the arteries going to the lower limb. How to treat peripheral arterial disease? The best initial therapy is aspirin to prevent platelet aggregation on top of this atherosclerotic plaque. So aspirin to keep the blood flowing, to prevent and inhibit platelet aggregation. Together with, of course, you have to control your blood pressure, you have to control your LDL, your bad cholesterol. You have to keep it less than 100 because it's an atherosclerotic disease, and you have to do exercise as tolerated because the best anticoagulant ever is flow. So keep the blood flowing, keep exercising to improve the circulation to your lower limbs. And there is a specific drug for this condition, which is cilostazol or Platal. What's that? It's an antiplatelet. It inhibits platelet aggregation, and at the same time, it is an antispasmodic. So it kind of relaxes the blood vessel, and at the same time keeps the lumen free of aggregating platelets, and that's why it helps. Pentoxifillin or Trental. What's that? It's a marginally effective drug. It helps in the deformability of the red blood cells, so it helps the red blood cells squeeze into the narrowed vessels. Calcium channel blockers are not effective. Calcium channel blockers are not effective in the management of peripheral arterial disease. Why? Because when you give calcium channel blocker, you dilate, you relax the muscles of the arteries from without. But the problem is from within. We have an atherosclerotic plaque inside the lumen, not around the lumen in the muscle layer. Therefore, calcium channel blockers not effective in peripheral arterial disease. It's well known that beta blockers can worsen peripheral arterial disease. But how about a patient who's taking or who needs beta blockers for some life-threatening condition like heart failure, congestive heart failure, or severe ischemic heart disease, or previous myocardial infarction, or arrhythmias? In these conditions, you have to give beta blockers for these life-saving conditions or for the improvement of survival, despite the fact that beta blockers can worsen a little bit the peripheral arterial disease.